Welcome to Sparrow Hospital Emergency Medicine Residency Program. Our program was founded in 1973 in Lansing, Michigan by Dr. John Wigginstein, who is also the founder of emergency medicine. Our program is affiliated with MSU and next door to our headquarters for ABEM as well as MSEP. The program takes 8 residents per year. Sparrow Hospital has 70 private emergency medicine rooms. We also have fairly new ultrasound machines. We have 4 trauma bays, and in the trauma bays we have access to every resuscitation equipment that you will need. We have glide scope, we have fiber optic capability, anything that you will need to resuscitate a patient.
We split our time between Sparrow, Maine, as well as a community-based center that's also in Lansing, McLaren Hospital. They're actually finishing the construction of the new hospital at McLaren, and it is set to open in March 2022.
The 2 hospitals that the residents spend their time at during residency are really the only 2 facilities within a 45-50 mile catchment area. So you're going to see all comers to the emergency department.
The lower acuity, the fast track concerns, we get a lot of those experiences at the McLaren Emergency Department, where we are also the primary ER residents. And that is where you'll kind of get a greater feel or sense of what it's like to be a community ER doctor, and less of kind of that constant flow of very critical patients, which is what we see here at Sparrow, Maine.
I think one of the things that feedback we receive on our exit interviews from residents that are graduating, as well as from our current residents, are that we have a very strong didactic curriculum every week. We spend between 20 and 25 hours a month going through content in the small group setting, as well as the large didactic-based setting. We've made an emphasis of encouraging more small group learning. About 45% of our time is spent in the small group setting. We spend time in simulation, in ultrasound. We spend time, especially with the 1st and 2nd year residents, going through some of the core content of emergency medicine. As you progress into your 3rd year of residency, you spend less time learning just core content of emergency medicine during these small group sessions, and we spend a lot more time learning some of the more cutting edge medicine. We have emphasized our residents taking advantage of a lot of the great resources that are out there. When you come here as a resident, you get a subscription to Rosh Review, to Hippo Emergency Medicine, EKG Weeklies, and you're responsible on a weekly basis for going through some of this content. Our content has led us to achieve really great things with regards to our board pass rate. In the last 4 years, we've had a 98% first-time board pass rate for our residents, which is well above the national average of 90 to 92%. And I think that says a lot not only about our curriculum in and of itself, but also the dedication that our residents have when they come here. They're eager to learn, they're eager to set that foundation of where they need to be great clinicians, and they come every week to conference really well prepared and wanting to participate and better themselves. And I think this not only makes them better test takers, but certainly makes them better clinicians in the emergency department on a day-to-day basis.
When I was trying to make a decision as to where I wanted to go for residency, there were 3 things that were really important to me. 1, I wanted to be at the level 1 trauma center in the area.
Yep.
We also are the major STEMI center in the area. So if EMS has any concerns regarding a patient potentially having a heart attack, they will automatically be rerouted to this area. In addition, this is the major stroke center in the area, and we also have the capabilities for thrombectomy. So if you're outside the window of TPA, your patient has a chance as long as they're within that 24-hour window and have evidence of a large vessel occlusion on imaging.
The first 2 months for an intern are sort of an introduction with ultrasound and the emergency medicine portion. You have 2 weeks initially with ultrasound with Dr. Price and various other attendings who go through the different scans that we can do at bedside. So intern year, we have the 3 months in medical ICU. I think that Sparrow is unique in that we have so much time spent in the ICU that it really gears us to take care of the most critical patients.
When on our ICU months, it is solely ER that runs the intensive care unit. And so that is a great opportunity for ER residents, interns, 2nd years and 3rd years to come together, learn from one another, and that's when our interns really pick up their procedural skills.
The best memory so far probably has to be ICU. It's been the most challenging month in the world, but also the funnest, just to see everybody in stressful situations, but it brings out the best in you at the same time.
Sparrow is the only level 1 trauma center in mid-Michigan that has 24/7 pediatric emergency department coverage.
Our department is staffed by EM trained docs and also PEDS EM trained docs.
Throughout the 3 years, we do have opportunities to do various electives. Neuro ICU is a popular elective amongst our residents as it gives us more exposure to a very unique population. Other electives include ortho, optho. Some of them elect to do more ultrasound, which is always good. So wellness is a big aspect of this program. Every second year class designates 2 of the residents to be wellness coordinators. Their job is to plan every 2 months a wellness retreat for the entire residency. And some of the things that we have done in the past have been sledding, tubing, we've gone to parks. One of the popular ones is going top golf.
Some of the benefits that our residents enjoy are access to Dragon Medical, which is a dictation service that allows you to make your charting much more easier than having to type out all of the charts. They are also trained in Epic and Cerner, both major EHRs that are heavily used throughout the United States.
Last year, as many of you know, there was a little bit of a concern about will we be able to find jobs, and I can say really all of our residents by January or February were able to find jobs, and it really wasn't as big of an issue for our residents graduating from our program as maybe the thought initially was going to be. Our residents have been extremely successful in finding jobs. We're one of the oldest residency programs in the country. We have alumni throughout the United States in all different types of settings. We prepare residents to go to any type of environment upon graduation. The majority of our residents end up going right into clinical medicine, no fellowships. They're working in large academic centers, community-based centers, as well as some people going straight into rural emergency departments. In the last 3 or 4 years, we've had a greater interest in individuals pursuing fellowships. Last year, for instance, we had one individual do a critical care fellowship, one graduate doing a medical toxicology fellowship. The year before, we had someone do international medicine.
I think when it comes down to what you want as an ER doctor, you want to ultimately finish your 3 years of residency training knowing that you've cared for truly the sickest patients in your area. And I believe we get that. Our program does a great job of addressing weaknesses that residents believe might be present. And because of that, I think that it's truly set me up to be the most complete ER physician that I could be.
Thank you so much for all of your interests in our program. Please feel free to reach out if you have any questions.